hospital curve has declined, bearing in mind that still the majority of deaths do occur in hospital, including those who are resident in care homes.
Beth, thanks very much. Andy Bell from Channel 5.
Thanks very much. You have your 5 tests that you say have to be met before we can move on in terms of lockdown. Right now, how many of those tests do you think you're passing?
Well, as I said when I set them out, we will need the advice from SAGE, which was going to be 3 weeks after, I think the 16th of April, so it will come early May. So we don't know yet. There is some positive signs in the data, but as Yvonne has said, and as we've been at pains to say, we're at a delicate and dangerous moment in this challenge. We're coming through the peak, but we're not there yet, which is why keeping on focusing on the social distancing measures, which has been one of the great successes of the approach taken because of the support of the British people, is so important. So people sitting at home watching this have saved lives by following that guidance. And until we're out of the woods, if I can put it like that, and they need to keep doing that. And we won't know that we've reached that point until SAGE give us that review of the evidence.
Can I come back in on that?
Sure, of course.
But the government has said several times that the NHS has not been overwhelmed, has not been overtopped. Are you saying you're not even satisfied at this stage that you can say you've passed test number 1?
Well, the NHS quite clearly hasn't been overwhelmed. That's been the second key critical bit of the strategy which we delivered successfully. It's a great credit to those in the front line, but we have also got the ventilator beds, the critical care capacity up. The military have done a great job in supporting the new Nightingale hospitals. So we're confident at this stage, but of course if you look at the 5 tests, Andy, and I know you're taking this very seriously, we've also said that we need to make sure that we can see to the future that will still be the case, and also that with any changes we might make and what that would do not just to the coronavirus infection rate as we've seen in Germany, but also to the non-COVID cases, we need to be confident the NHS will be able to cope. So you're right absolutely to point to the 5 tests. And I've just got to say, at this moment in time, we're waiting for SAGE's evidence on all 5 aspects, which we're expecting in early May. Can I bring in Jason Groves from the Daily Mail?
Hi, thanks. Foreign Secretary, you may have seen overnight the new Mail Force charity has brought in £1 million worth of PPE from China. Now, you know how difficult that is. You've got your own challenges with PPE. I wondered how helpful that sort of private sector initiative is. And to Professor Van Tam, we've heard a little bit about this idea that the virus perhaps spreads more slowly outdoors than it does indoors. I wonder if you could tell us a little bit more about that and what the implications of that might be.
Well, look, Jason, fantastic Mail Force campaign, 100,000 masks, 50,000 overalls, all going to those frontline workers in the NHS, in care homes. I've just got to pay tribute. The Daily Mail has really contributed to that national effort that we were talking about, and it all counts. So huge thanks, I think, from the government side. Jonathan.
Okay, so thank you for the question about how the virus spreads and to what extent it spreads. And if I can just replay the question back to you to be sure I heard it right. You were asking about the difference between indoors and outdoors.
Yeah. Yeah, that's right.
Okay, so we have learnt a great deal over the years from studying influenza and patterns of transmission of influenza. And I accept that the coronavirus is a new virus. It is not entirely the same as influenza, and we are getting more and more data on transmission of COVID-19 as the days and weeks roll by. But nevertheless, there is a definite truism across all of the science literature that ventilation is a most critical part of reducing transmission from respiratory viruses. And if you think about being outdoors, first of all, by and large, distancing between human beings is greater anyway. But if you just stand still for a moment and experience just normal breezes and air currents around you, you absolutely get a sense that any kind of plumes of anything are going to be very rapidly dispersed. And from that perspective, it is absolutely categorically clear that outdoor spaces with higher degrees of ventilation are less problematic environments for transmission than indoor spaces. And of course, you only have to go as far as thinking about flu and summer, winter, and the way we live our lives. In the winter, we live indoors in conditions of relatively low ventilation with the windows closed. In the summer, we go outdoors, we leave the doors and the windows open when we're at home.
Jason, do you want to come back on any of that?
Yeah, well, I was just going to, thanks for your comments, and I was going to come back on that latter point. I mean, people obviously thinking about what's going to happen in this next phase. Given that difference, might it mean that there is some hope for things like garden centres, outdoor events like park runs, going to the beach, maybe even beer gardens before people sort of give up hope?
Thank you for the question. I completely get it and understand why you're asking the question. SAGE absolutely is keeping all of that evidence under very considerably detailed review, and that evidence has been formulated into guidance that we are putting forwards to ministers on a periodic basis. Now, in terms of any of the events any of the settings that you mentioned, I just want to take us through the journey a little and say that these are complex, and at various different points they might involve the congregation of individuals, and one has to be very painstaking and very careful about thinking through some of these before we make the wrong move to relax measures. And so from that perspective, I think all of your comments are valid, but I think we have to be extremely sure-footed and extremely painstaking about this. This virus will absolutely come back. You've seen Secretary of State refer to the resurgence in Germany and the difficult considerations that are going on there. This is with us for quite some time, potentially for as long as until we get a vaccine. So from that perspective, we have to be really careful and really sure-footed, and I'm just not going to suggest for a moment that any of this should be rushed.
Thanks, Jason. Dan Bloom from the Daily Mirror.
Hello. I'd like to ask, if we had been able to access better testing and screening earlier than we did for care home residents, so for example, testing those discharged from hospital before mid-April and some of the other things the government has introduced, might some of the deaths that have been published today been avoided?
I think there's always learning in an unprecedented, unique crisis like this that we'll want to feed back in to make sure that we can refine and fine-tune the measures we're taking. You'll know, Dan, we take the actions and the steps that we take on the best scientific evidence we've got at the time. I think in relation to care homes, as I mentioned before, the key thing above all is to manage the transmission of people, that the ebb and flow of people into those care homes that might carry the virus. And that, of course, includes family members and friends. It includes people that are working in more than one care home setting. It includes NHS staff. So on top of testing and PPE and all the things understandably you want to raise, I think that's probably the single most important aspect. Do you want to come back on anything else there, Dan?
I'd quite like to ask the medical experts what they think of the same question, because they may have an opinion on it.
Of course. Yvonne.
Yeah, thank you, Dan. So it's a very good question, and it's also a learning one. But I put it this way: where there have been outbreaks in care homes, there has always been intervention throughout this. That would be no different to normal practice. What we have learned a lot about is how the virus is behaving in different populations. And one of the very sad things that we have found is that the virus, when older people get this virus, it is affecting predominantly older people, particularly people over 75. And one of the reasons that the deaths are high there is that actually they demise quite quickly if they get if they get the dose of this virus that perhaps a younger person might be able to put over their shoulder because of the way their immune system works. So that's one feature. So it may not even be possible to have got to the test by the time the event happens. Second, we've now learned from looking at the literature that we've asked us what is it that would make a difference to stop this epidemic in a home. And the movement of staff is an absolutely critical one, and how the virus actually moves within a home. And that has really only begun to become evident since we've been able to look at new techniques like genomics. And that has given us a huge insight into the dynamics of what is happening within a home. And not every home will be the same in the way that, you know, people, residents and the staff interact, the use of bank staff. But there is some very interesting learning that we've come across quite recently. Now, whether testing would have made a huge difference or not is impossible to say at the moment, and that's one thing we'll want to learn. But there has been testing, but I think there are possibly more fundamental and structural issues about how care homes are run in an epidemic that we are now looking to implement.
Thanks, Dan. Matt Foster from Politics Home.
Hi, First Secretary of State. Your colleagues have spoken about us all being in this together, but there are a sizable number of people in the UK who, despite paying taxes, are barred from claiming universal credit, housing benefit or free school meals for their kids because the Home Office has deemed that they have no recourse to public funds. Some of those people are working in key frontline jobs right now in the NHS, social care and as delivery drivers. Will the government consider at least temporarily pausing NRPF status during the outbreak? And if not, what reassurance can you give people that they're not going to be shut out of the same help we all may need to rely on during an economic crisis?
Look, I absolutely understand the point, and obviously we feel for anyone who's going through the challenges, whether professionally or in their home. I know the Home Secretary has been looking at this very carefully. She keeps these issues under constant review. I think she's been before the Home Affairs Committee today and said that we'll always look at new measures and what more can be done, particularly in relation, I think, to frontline workers from overseas who are working within care homes or the NHS. So I can't give a commitment, but I can tell you that the Home Secretary is very carefully looking at that, and the government wants to make sure we're as sensitive and as flexible in our approach as we possibly can be. Do you want to come back with another one there, Matt?
That's fine, thanks.
Very good. And then finally, Peter Madley from the Express and Star.
Thank you, Secretary of State. Question for the medical experts. Schools across the West Midlands are starting to consider how things might look once they're up and running again. The Education Secretary said today that schools will reopen in phases and clearly some form of social distancing will be required. Can you give us an idea of how you think social distancing will work in a school setting, and do you envisage home education continuing for some pupils into next year? Secondly, a question for you, Secretary of State. You mentioned repatriation flights before. There's still thousands of British citizens stranded in India, particularly in the Punjab region, a lot from West Midlands in that area of the country, in fact. The CTM charter team has said this week that more than 20,000 people have registered for flights, but from an Amritsar in the north, there's only one flight every couple of days with a maximum capacity of 300. So people who are running out of money and medicine are being told it's not possible to confirm when they'll be able to get back. Now, do you have an idea of how many Brits are stuck in India, and are you planning to increase the number of repatriation flights from northern cities so these people can return home?
Well, thanks very much. And look, can I first of all say the incredible effort from the West Midlands, where you're reporting both the NHS, care homes, and frankly the people following the social distancing guidance has made a massive difference. We follow the regional impact of all the measures that we're putting in place at NHS capacity, and I know the West Midlands have put in an incredible shift. On repatriation flights, and just to give you a sense, we've already chartered, so separate from the commercial flights, 58 returning more than 12,000 people from across South Asia. I can tell you that in recent days we've announced 28 more charter flights with the capacity to get around 77,000 more Brits back home. They'll return home. That scheduling would be up until about May the 7th. They include 14 flights from India, another 9 from Pakistan and 5 from Bangladesh. So we're doing everything we can.
I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better and better. So I'll stop there, but I'll be happy to answer any questions.
Does that make you more comfortable?
Why don't you go first and then you go?
Does any of this data change the timeline of the development of a vaccination?
No, this has nothing to do with vaccines. This is treatment for people who are already infected. Vaccines is to prevent infection in those who are at risk.
Do you have new data on vaccines?
No, nothing more than that. What I continue at the press conferences that we have regularly, keep you up to date, that everything is on track with the phase 1 study. We're in the third part of it. We're going to go into phase 2 in the summer, but nothing has changed that anything I've said when we had press conferences.
Tony, they're writing a lot about Oxford. We know Johnson & Johnson